Good day. I am Dr. Ryan Martinco, an ENT head and neck surgeon practicing here in Cebu. Today, we're going to talk about the nose and the paranasal sinuses. Let us start with the anatomy and physiology. This will also serve as a review of our basic knowledge for this area. The anatomy of the nose consists of the external nose, the nasal vestibule and nasal cavity, as well as the paranasal sinuses. The external nose is made up of a bony framework composed of a nasal bone, a frontal process of the maxilla, and a nasal process of the frontal bone, while the cartilaginous portion is made up of the upper lateral, the lower lateral, the lesser alar, and the sesamoid cartilage. The muscles of the external nose play a role when showing different facial expressions by elevating, compressing, depressing, and dilating the external nose. These muscles are supplied by the facial nerve. The main blood supply of the external nose comes from the angular artery, which is a branch of the facial artery, the lateral nasal artery, which is a branch of the maxillary artery, and the dorsal nasal artery, which is a branch of the ophthalmic artery. While the sensory innervation comes from the ophthalmic and the maxillary branches of the trigeminal nerve. The internal nose is bounded anteriorly by the vestibule, which is lined by stratified squamous epithelium, followed by the narrowed areas known as external and internal nasal valves. The posterior border of the nasal cavity is bounded by a space called choana, which connects the nose to the nasopharynx. Together, they are lined by pseudostratified columnar epithelium. Inside the nasal cavity, we can identify the superior, the middle, and the inferior turbinates with their corresponding meatus. Remember that the inferior meatus drains the secretion from the nasolacrimal duct. The middle meatus receives secretions from the maxillary sinus, the frontal sinus, and the anterior ethmoid sinuses. Lastly, the superior meatus will have the sphenoethmoidal recess, where mucus from the sphenoid sinus and the posterior ethmoid sinuses exit. Again, just showing pictures of the different paranasal sinuses. Mind that the middle turbinate will divide the ethmoid into anterior and posterior ethmoid sinuses. The nasal septum is a mixture of bony and cartilaginous structures situated in the midline of the nose. It is mainly made up of septal or quadrangular cartilage, perpendicular plate of the ethmoid bone, and the vomer. Let us now proceed to the physiology. The basic function of the nose is for respiration, olfaction, and phonation. During respiration, the nose serves as an airway, humidifies the air as well as plays a role in thermoregulation. It also filters out particles, produces mucus, and provides immune response. The mucociliary clearance and mucociliary transport is the most important defense of the upper and lower respiratory tract. It is driven by coordinated beating of the ciliated cells at a rate of 8 beats per second at 20 to 25 degrees Celsius and 12 beats per second at 37 degrees Celsius. Take note that the function of the cilia is greatly affected by temperature change. Therefore, a person might experience different nasal conditions with different environmental conditions. This video shows the mucus layer retaining some particles entering the nasal cavity and the paranasal sinuses. And with the ciliary action, these particles are being removed from the respiratory lining. Bear in mind that the mucus will always move towards the sinus ostium and posteriorly to the nasopharynx. Now let's move on to olfaction or sense of smell. Is this important? Yes, because 45% of patients with anosmia dies from spoiled food, LPG leaks, fire, chemical toxins or fumes, carbon monoxide poisoning, secondhand cigarette, and tobacco smoking, etc. Also, the perception of odor adds quality to life that is difficult to express. Can you imagine eating the first meal of your day, wearing perfume, or drinking coffee without a smell, or the scent of flowers during Valentine's Day, and the bad odor of neck abscess when you drain it in the operating room? The sense of smell is also directly connected to vision, hearing, temperature, sleep cycle, and memory. Have you ever noticed remembering your first date after smelling the perfume you wore that day? Please familiarize these terms used to describe the sense of smell. So how do we smell things? 15% of the air we breathe in will reach the olfactory epithelium, located 7 centimeters at the roof of the nasal cavity. Once the molecule adheres to the mucous lining and travels towards the olfactory bulb, it will be processed, transmitted to the different centers of the brain, and interpreted as odor. Several factors affecting the transmission of the molecule include character of the carrier gas, solubility of the molecules in the mucus, amount of olfactory epithelium, flow velocity of the air that enters the nasal cavity, and the area of the nasal passageway. Some important considerations relating to the sense of smell. Odors are understood based on experiences, whether you like or dislike the scent. The sense of smell is already present as early as 6 to 10 days of life after birth. At 3 to 5 years old, babies will have odor attachment to their mother, especially when they are breastfed. By 2 to 7 years old, children can already show odor preferences. Odor could last for a year within a person's memory and a few months within the visual memory. It is also affected by age. Males are known to have inferior sense of smell compared to females. Adaptation and habituation happens 1 to 5 minutes after being exposed to a certain smell. Lastly, the nose adds resonance to the quality of voice. Thank you and have a good day.